Good day. I'm Renee and Carmelo Feliciano, a pediatrician in training from the Philippines, and on behalf of my co-authors, I'm here to present to you Fragile, Handle with Utmost Care, a clinical case of acute lymphoblastic leukemia in a child with osteogenesis imperfecta type 5. This is a case of an adolescent male with a personal and family history of recurrent fractures. He has clinical and radiologic findings compatible with osteogenesis imperfecta type 5. At 11 years old, he presented with high-grade fever, gum bleeding, and blast cells seen on peripheral blood smear or PBS. He was subsequently referred to genetics and hemo-oncology services where a peripheral blood flow cytometry or PBFC confirmed the diagnosis of B-cell acute lymphoblastic leukemia. Acute leukemia is diagnosed when blast cells comprise 30% or more of the nucleated cells in the PBS. Peripheral blood flow cytometry is a highly sensitive and specific test for assigning lineage when blast cells are 50% or more. In most cases, follow-up bone marrow flow cytometry is not necessary. BMFC is recommended if less than 50% of cells in the PBS show abnormal morphology. He underwent chemotherapy using low-income countries type 2 protocol. From a clinical standpoint, having osteogenesis imperfecta did not affect his ability to tolerate and respond to chemotherapy. However, the dilemma exists in treatment response monitoring, that is, whether or not bone marrow aspiration will be performed, considering his underlying bone condition. B-cell ALL patients reportedly don't have detectable cells with leukemia-associated immunophenotypes in the peripheral blood despite its persistence in the bone marrow. Thus, BMFC is used to monitor chemotherapeutic response at the end of the induction, delayed intensification, and maintenance phases of LIC2 protocol. In this patient, however, due to his innate risk for pathologic fractures, instead of using bone marrow aspirate for flow cytometry, determination of treatment response was modified by using clinical status monitoring and CBC monitoring. This emphasizes the importance of considering management alternatives for a specific illness as it may potentially affect the management of an existing comorbidity. This report adds to the literature on the rare co-occurrence of osteogenesis imperfecta and acute lymphoblastic leukemia. Further studies may be done in the future to establish the association of the two entities. Thank you very much.